Well, I want to thank people for joining us on a AME virtual tour. It's a way that we're able to share information and learn from each other, even in these days when we're impacted by COVID. I want to introduce you to the Virginia Mason team. They've been involved with implementing and standing up a COVID mass vaccination site, and they're going to share the tools and the methods they use to execute this model with lean thinking. We've got 3 Virginia Mason team members with us. Dana Nelson Peterson has been with VM for 35 years. She's a vice president of nursing and associate chief nursing officer, and she's also worked in the Kaizen promotion office at Virginia Mason before. We have Jessica Dunn, who's a senior director of nursing and ambulatory surgery services, and she's also been part of the Kaizen promotion office at Virginia Mason and is rolled also into leadership roles. And then Nate Higbee is currently part of the Kaizen promotion office at Virginia Mason, and he's going to help present our information. And as we get started, I want to let people know we have a discount available for a healthcare summit that AME is promoting for the week of August 3rd. It's on the 3rd and the 4th. If you enter all caps today 50, you'll get a discount on the event, where we've got some really significant keynote speakers and also a number of organizations that are providing virtual tours. So with that, we'll be turning it over to Nate. If you'll post questions in the chat box, we'll go over those once the Virginia Mason team's done with their presentation, and we'll make sure we get those questions answered. And Laura has already posted the discount code into the chat box to break the ice. So
okay, well, good morning, everybody. Thank you for giving us this opportunity to share our body of work, our outcomes, and our learning opportunities as we use the Virginia Mason production system to stand up a vaccine clinic. So Virginia Mason, next slide, is a 336-bed hospital located in downtown Seattle, Washington. We have 9 regional medical centers across the King and Kitsap counties, and we employ about 5,500 team members. That was us up until January. Now we are part of an 11 hospital division in the Pacific, across the Pacific Northwest, called Virginia Mason Franciscan Health, a subset of the Common Spirit Health system. We use the Virginia Mason production system as our management methodology. We began our journey, our lean journey, over 20 years ago, and we've certainly had a lot of evolution in our work over those past 20 years. And I think you'll see that many of the lean concepts are embedded in our presentation this morning. Next slide. So back on December 12th, we were informed by our Governor, Jay Inslee, that vaccines would be arriving to our facilities within a few days. And at that particular point in time, we had no infrastructure in place to stand up a vaccine clinic, let alone infrastructure to vaccinate thousands of team members as well as our community. The way that the vaccine program was rolled out was in a very phased, very prescribed, phased approach with tiering of which populations of people would be provided the first opportunity to get vaccines and then rolled out. So very, very scripted, phased rollout. Next slide. On the 16th of December, we actually gave our first vaccines to a couple of our providers live on air on the Today Show. This is Dr. Elliot Fagley and Dr. Atul Gupta, 2 of our critical care intensivists that care for these COVID patients in our hospital. So that was on the 16th of December, and a few days later, we did a soft launch in our human resources building. So our human resources building was chosen because of the fact that it has no, it was a clinic, or it was not a clinical space, it was an administrative area that we could displace the people that worked in there and use those rooms as exam rooms, so to speak. So our first vaccine clinics in the HRB building, we had very limited capacity to be able to meet the huge demand for these vaccines because of the lack of space available to us. We could only flow so many people through there at a time, and still stay in accordance with the physical distancing. And then the air quality was of some concerns as well. So the first people that were vaccinated in the clinics in the HRB building were our elders in the community and also our healthcare workers. And because of the space constraints, despite very expanded hours, we were offering from 6 in the morning till 9 at night, we could only put through about 400 patients per day. Next slide. One of the reasons that we could only put about 400 patients through per day was because of the cumbersome process that our vaccinators had to go through to document the vaccine administration. This was being done in our electronic health record, so all patients needed to be registered into our system so that a medical record number could be provided. The vaccinators for every patient had to go through several steps to place an order, to document the vaccination on the medical administration record, and then to complete a clinical note in the computer documenting the consent for the vaccine. And all of this information was mandatory because it needed to be uploaded to the Washington State Immunization Department on a nightly basis. So we were hobbling along in the HRB building when, next slide, out of the blue, we got a phone call on January 19th from Amazon. We had never gone into any partnership with Amazon before, and they reached out to us because they wanted to partner with us to execute on a mass vaccination strategy. They chose Virginia Mason because of the focus on quality and safety, as well as they were very aware of our lean methodology. So on January 20th, the day after that phone call, the phone call came in about 4 o'clock in the evening. That very next day, a small set of us went down to the what's called the Southwest Lake area, which is like little Amazon, and toured several of their potential sites. And we decided on landing on the Amazon Conference Center, which is on the bottom picture. You can see what that looks like inside when it's set up with all the bleachers and chairs and a podium. Next slide. So in 4 days, this is what's pretty remarkable. In 4 days, we were able to pull together our first Amazon event, which occurred on Sunday, January 24th. We had enough vaccine to give over 2,000 patients an opportunity to get vaccinated. But if you think of what we had to do as far as understanding the logistics of the space, understanding how we were going to secure the number of volunteers necessary to run patients, that many patients through in that period of time, how to go in and create a schedule for scheduling all these patients throughout the course of the day. We ran from 8 in the morning till 4 o'clock in the afternoon, and then to get invites sent out to thousands of patients to make sure we captured at least 2,000 registered patients. So a lot of logistics getting up our first super vax up and running. And in retrospect, it's amazing we were able to do that in 4 days. So on January 24th was our first super vax event. You can see here what in the middle screens, what it looked like, that space, how it was laid out to accommodate. That's the observation space on the top, and then in the back, the bottom is the vaccination stations. So it was a great day full of huge learnings. Next slide, please. We vaccinated over 2,400 patients, but we had a median lead time, which was a little too long for us, almost 23 minutes from the time a patient checked in till they departed. And part of that cycle time or lead time is the 15-minute mandatory wait state post-vaccination. We saw lots of bottlenecks in our the design that we had. We had opportunities to improve our flow. We had opportunities to improve our visual control. We had opportunities to move forward with kitting of supplies, and certainly doing more internal setup for our team members. Next slide, please. So our second super vax, the following week, we had some big breakthroughs. You see, we went from the first super vax, things just all came down scattered in cardboard boxes. We were able to kit all the supplies so that each station we were running, I think, we had a total of 39 stations. Each of them had standardized kits. We introduced a lot of visual control for our patients to provide them information and provide them direction. And we also if you can imagine scheduling hundreds of volunteers for each of these events, it was a very arduous task. So we actually stole shamelessly from our volunteer program that used a program called Logistics that was a electronic sign-up sheet for our volunteers, and that really created a lot of improvements in our ability to run our subsequent super vaxes. We also, at the same time, were starting to get multiple asks from community agencies across the Puget Sound area wanting to partner with us. And they were coming in very sporadically to different leaders. So from everybody from the Port of Seattle to Safeway stores wanting to partner with us. So we kind of paused and said, we just need to do a little micro event to come up with what our overall COVID-19 vaccine strategy is going to be, making sure that we focused on ensuring that our strategy was patient-centered, that it was equitable, that it was sustainable, and it was flexible and scalable. So we took a time out and a group of leaders came together to come up with what our strategy going forward was. And it certainly was going to continue to focus on partnering with Amazon at the SuperVax events. Amazon were phenomenal partners. If you want to go to the next slide, please. In that they provided all the setup of the logistics of the room, the tables. It was kind of a joke at the time, but 1 year into the pandemic, we were having to do our work with not off-brand or homemade Purell sanitizers and wipes. And Amazon, remarkably, had name brand Purell and name brand Clorox and Lysol wipes for wiping down the sites. And that was really quite something that they had access to all of that. On our first weekend in February, we introduced the concept of daily management and leader standard work. We introduced the concept of huddle boards, where we would huddle in conjunction with our site leads of all the various roles, as well as our Amazon leaders, every 2 hours to look at where we were as far as projected versus actual with regards to flow of patients coming in. We had a kind of a miserable failure at that time of a PDSA where we started to actually have pharmacy drop the syringes for the vaccinators. And this was in part due to fear of wasting any vaccine at the time. The vaccine was like precious gold to us, and we were really mandated to not waste a drop of it. And so in attempts to try to not waste vaccine, we actually created huge bottlenecks and stopped the flow of patients coming in altogether. Next slide, please. There was a considerable amount of bottleneck up front in the check-in process. Originally, we had a table set up where the patients would be kind of queued around the lines and then come to these individual tables to talk with the reception and get them checked in. They did a great job at PDSA and getting rid of those tables and moving the check-in to stand up, and you can see how that increased and improved our cycle time. So we were really looking at seconds. When you're dealing with a process that was 25 minutes or less, we were focusing on shaving off seconds off of our overall lead time. Next slide, please. And then the governor and the Department of Health on February 9th signed into motion an act called the PrEP Act. And basically what the PrEP Act was a way to allow retired providers, these are physicians, advanced practitioners that are no longer licensed, to come back into the workforce as volunteers to assist in vaccination events. So at Virginia Mason, what we needed to do was figure out how could we, because we had quite a few of people that had since retired wanting to come back to work, how could we bring them on board in a very quick fashion that was making sure that we built in quality checks along the way and that they had competencies. So we used a tool called the Process at a Glance, which really takes us through step by step the process of bringing these people back into the workforce as volunteers, understanding their methods, the skills necessary, the materials, etc. Next slide, please. As we went through the weeks, then we were doing back-to-back Saturday, Sundays every day, every weekend. So for several of us, we gave up our weekends through the winter and spring months. And we were able to identify opportunities for new roles that we hadn't thought of before. The concept of a line patrol was put in place, and what the line patrol did was banding patients that were actually appointed. Remember, at the beginning of the vaccine efforts, the demand for vaccinations was very, very strong, and people were trying every which way to get in the door to get vaccinated. So by identifying people downstairs before they even came up into the conference center for their vaccine, by using armbands, and then really enhanced our visual controls for our vaccinators so that we could ease the burden of work for them. And there's just a picture of some of the examples of some of the visual controls. Next slide. Then we also understanding that a lot of our patients that we were seeing were elders, and mobility assistance was a key thing that we needed to provide for them. So we created the mobility assist role, where we had people stationed down in the parking lots to help people get out of their cars by offering wheelchair assist, getting them upstairs. And then we also were doing a small PDSA in the back and in the observation area by actually moving the checkout process to the vaccinator. So that next slide, the vaccinator ended up doing everything in flow. So we introduced the barcode scanner. We were having a lot of defects with inaccurate information being put into the system as far as what site the vaccine was being given, the wrong drug being given, Pfizer versus Moderna. And so we were able to eliminate all of the defects that we were seeing on the back end by actually having the vaccinators do a full one-piece flow of vaccinating and then checking out the patient in flow. The other thing that was introduced during this week was a predictive tool that was created, homegrown, where on an hour-by-hour basis, we could actually reforecast what our end-of-day projection of vaccines were going to be based on building in a no-show factor on an hour-by-hour basis. So this was a key pivotal piece of information that helped us in making sure that we did not waste any vaccine. The following weekend, we reintroduced the concept of setup reduction. Next slide, date, on putting in place the concept of the vaccinator prep. So we had a team of 5 or 6 team members that were actually drawing up the syringes. And then the syringes were delivered in those little white clear trays you see there, already pre-filled, ready to give. And this really helped shave off time off of our vaccinators' role. And then improvements in April continued on. You'll notice in this next slide, the circle there around the clock. One of the most difficult things for our vaccinators was to project in flow what 15 minutes would be base for the 15-minute wait time, and write it down on a little piece of a sticky label and place it on the patient, which was the visual control for the observer area to know when the patient's observation time was up and they could go. So we introduced the idea of these little clocks as a poke-yoke by putting the preset 15, all the clocks were set 15 minutes ahead. So the vaccinators just had to look at the clock and then write down the time on their clock. We also introduced these little bells, because when the clinic was full and there's hundreds of people going through, oftentimes if the vaccinator had a patient emergency, they would ring the bells and then the team would run towards them. Next slide. And then our medical tent evolved during the course of the different vaccine clinics. We started with 2 stretchers. We added the recliner for those patients that had vasovagal episodes. And all of the supplies were kitted and ready for use for our medical tents that always had a physician or advanced practice provider in them. And then the next slide, again, just really highlighting the daily management, the production boards, all of the standard work that was created for each of the lead roles, put together into a playbook so that if we ever have to do this again, we can pull that playbook off the shelf and rebuild the SuperVax event, which is not out of the question whether or not we are ending up going to have to give boosters to people. Next slide. This next slide really speaks to the playbook that we put together and all of the different elements of standard work, the visual controls, etc. And then finally, just wanted to briefly touch on the training of our volunteers. At first, it was pretty labor intensive in conjunction with our clinical practice professional development team members. But what we did was externalize that training by pushing out videos and workflow diagrams to our volunteers when they signed up for a volunteer shift. And then we would sign them off on the actual site itself, doing a competency check. And I'll turn it over to Jessica so she can share some of the outcomes.
Thank you, Dana. So thank you. I was also part of the leadership team for this work. This slide is showing our vaccinator cycle time. So this is when the patient comes in to get their shot, includes all the documentation, all of the clarifying of the consent form and things, giving the shot. So when we started out in our human resource building, that cycle time was 10.5 minutes per vaccinator. As you can see throughout the process, with all the improvements that Dana was sharing, we were able to really decrease that cycle time. You can see when we kitted our supplies, when we started having visual controls for our vaccinators. In the very beginning, we were using a lot of paper. So having patients actually fill out their consent form and attestation questions on paper, we completely eliminated that and put it into the system. When we started the syringe prep and then the vaccinators using the computer system, we did see a spike, but after root cause analysis, it wasn't really the computers. It was because we had so many patients coming through. I mean, our goal was to get to at least like 4,000 patients a day. So we again, and I'll share later, just expanding the amount of vaccinators we had to support the demand. But you can see here, we went down to a 2.5 minute cycle time, which is great. Next slide. This is also showing the beginning when we were in our human resource building and just how we just really couldn't do better than 400 and some patients a day. And so that partnership with Amazon was tremendous. Our highest day was 3951. You can see a drop there, and that was really when our demand, we had gotten all of the patients that were eligible at the time vaccinated, but also there was so much more vaccine to come available that other places were opening up, such as pharmacies and places in their local communities. So the demand for us at Amazon went down a little bit in May, but you can see the spike up again, and that's when we opened up to 12 years old and older. So we were able to get those patients filled. Next slide. And this is a great illustration we call our target progress report. This is really looking at all of the improvements that we made since we started. What was that impact of change? How did this improve flows? How did it improve quality? How did it improve just lead time for our patients and their experience? So you can see that we had a 32% improvement. And so this isn't just this is when Dana was explaining earlier, from when the patient enters the building to when that vaccinated patient leaves. So that does include the checking in, the vaccinator cycle time, the observation time, and also with first-time vaccine patients, we were actually scheduling them and getting them set up for their second appointment before they leave. So you can see that that baseline was 28 minutes. We went down to 19 minutes by the end of our SuperVax. So that was the end of February or April, which is really tremendous. And that includes, that, like I said, includes all of the process improvement work that we put into place. So that's tremendous improvement. And again, this is just an illustration of the vaccinator cycle time that I showed in that other graph. A 76% improvement in overall vaccinator cycle time, which is awesome. And to that end, which we don't have on here, once we move the vaccinators to the one-piece flow and doing the scanning and the documentation and flow, Prior to that, Dana had said we had a ton of defects. Our back-end people, our scheduler, our informatics team, they were working 3 to 4 hours a week or even a day just to clean that up. We went down to pretty much almost 100% defect free because we were actually doing it in flow using our technology, which was amazing. So our quality measure, we looked at the percent of prepared vaccines that were left over at the end of the day. I remember the very first SuperVax we had. We weren't as great as calculating our demand and how much we were preparing in vaccine. And so for those of you that might not know, once you mix the vial for vaccine, you have 6 hours to use that vial. And so we were mixing because we knew we had about 2,400 patients to come in, but we didn't anticipate no-show rates or things like that. So we overmixed. The end of that day, we actually had 100 prepared vaccines that we needed to put in people's arms. So we actually went back to our human resource building that evening, and we were there till probably 10 o'clock at night, just pulling people in to get those shots in arms. So I have to say, we did not waste a vaccine, but we did have them already prepared. So when we think about that as a 5% defect there, we moved to 100% improvement. And the calculation tool that Dana shared earlier was tremendous help on just understanding what our true demand is, our no-show rate, and then really partnering with our pharmacy team and leadership at that day to do sort of what we call the dose dance. So really calculating, we could get about 6 doses out of 1 vial. So we got really good at figuring out who is left coming in, what is our no-show rate, how many syringes have we prepared or should prepare. So that is just amazing quality work. We moved from what we call a level 1, which is kind of baseline, to a level 4 of really sustaining our 5S. So that's all the visual cues you saw, all of the things we put in place, our huddles and things like that, that really made our flow go. And then setup reduction. We would spend 3 hours a week on a Friday before the weekend to go set up at Amazon, bring all of our supplies in, set up our tables, make sure everything's in place. 3 hours. We reduced that by 83%. Towards the end, we just kind of 1 or 2 leaders would go over and say, yep, everything's good to go, we're set up, and leave. So that's amazing. Next slide. That's you, Nate.
All right, thank you, Jessica. So I work for Mason Franciscan Health, Seattle's Kaizen Promotion Office, and I had the privilege of providing BMPS support to the SuperVax efforts in the last winter and spring. So I'm going to be wrapping this presentation up with just a quick summary of some of our key improvements, and then just sharing some key learnings that we had around our management system and this work. So starting with the patient experience, as Dana and Jessica outlined, the addition of visual controls played an essential role in pulling patients through the process. When we first started the SuperVax, there was a lot of operator-driven, pushing patients through the process, having to navigate them through the flow. And with the addition of visual controls, patients were able to self-drive throughout the process. By streamlining the check-in and check-out processes, as Jessica and Dana outlined, we were able to reduce the time it takes for a patient to be at the SuperVax, and the less time it takes for a patient to be at the SuperVax means that more patients we can squeeze in and vaccinate. So it was really imperative that we look for opportunities to reduce that lead time. By looking at our patients, really understanding what their needs are, what their challenges were, we were able to respond by incorporating mobility assist, as Dana mentioned. And this actually really was instrumental in relieving the burden of the stress for those who might be mobile, have challenges with mobility, or their caregivers, and having to figure out how do we navigate through this process. And then also thinking about COVID 19 guidelines, social distancing guidelines, 6 feet apart, et cetera. The SuperVax allowed for that safety and allowed for higher air quality as opposed to HRB, which provided a sense of security for our patients. So what we have here is just a handful of patient quotes that kind of underscore just how powerful and important these improvements were for them. And just some key themes that emerged was they've noticed changes from when they got their first vaccine to when they got their second. Also looking at how efficient each step of the process was, how clear each step of the process was. The third quote in this slide is my favorite because I think it beautifully articulates how I describe this vax, which is this choreographed dance. It's this elaborate kind of complex movement of medicine and operators and patients and trying to have a seamless experience for our patients and for our team members. So I loved this quote that this person shared. Also paramount was really the team member experience. Really, the more we set them up for success, the more we're actually setting up the patients for success. So as Dana mentioned, centralizing the registration process, really thinking about how we have a single source of truth of who's coming to each SuperVax. Because of high turnover in our volunteers each weekend, it was paramount that we had robust training programs in place so that they could be brought up to speed and hit the ground running. That improved visual controls for vaccinators, which give them that agency to speak up and say, I need help, or I need to take a break, or I need more vaccines. What was also great about this work was that Dana and Jessica were really good at looking and trying to understand what additional operators, what additional support was needed, and building that into new standard work, and then set up production, as they mentioned earlier. We also have a handful of quotes from our team members, and themes that emerged here was rewarding, fun, reliable, and fulfilling. I think a lot of these people were very appreciative to have the opportunity to play a role in curbing this pandemic. Quality, Jessica and Dana already outlined some of these things, so I'm just kind of highly gloss over them pretty quickly. But I think the one thing that's important to stand out or call out is the fact that we were constantly meeting and trying to assess our demands, which, as Jessica mentioned, reduced the number of wasted vaccines. There is something going on with my slide deck here. Key learnings. So key learnings, I think one thing that was really powerful about this was that this was really kind of a chance for our organization to have our own moving line, to see from beginning to end the interconnectedness of each step in the process. So in the healthcare industry, this is not common because patients go into rooms, exam rooms, and they have, interactions with their doctors behind closed doors. This was a chance for us to see our management system play out, and it was kind of a playground for us to be able to incorporate different methods and see the impact of that. So I think that was a great opportunity for our team members to really enhance and further appreciate our management system. As Jessica and Dana mentioned, we had a PDSA around syringe prep that didn't quite work the first time, but we didn't abandon that idea. We actually resurrected it later on, partly because I think we understood the demand, we understood the business more, we knew what the impact would be. So by having that understanding allows us to be more smarter about PDSAs we roll out. Having mechanisms to assess the flow, health of flow is important. So for us, we were able to identify where bottlenecks would be, where symptoms of unhealthy flow would be. An example was the observation area. So if the chairs were half empty, that told us that we were not syncing up our demand and capacity. So it was a nice gauge. So looking for those gauges is really important. The 5 days that we had in between SuperVaxes was important for us to pause, reflect, and think about what are some ideas we want to do for next time, what worked, what didn't work, and then having the right people who buy into our management system was important for the effectiveness of this work. And then, of course, better never stops. This effort took a village. We had a lot of people involved, around over 2,000. Wouldn't have been possible without the help of our team members, without the help of Amazon, our retired employees, and then our community members. So thank you to everybody who supported this effort, and we look forward to hearing what questions you have.
Nate, thank you very much. Jessica and Dana, thank you for sharing your story. I really appreciate you taking time to help us understand. We had one question posted in the website. That was, how did you determine the 4,000 people vaccinated as a goal? Jessica, you want to elaborate on what you shared?
Yeah, and then I'll have Dana come in as well. But we really looked at, so the days we were open were really dictated by how much vaccine we had. So our goal was to work both days every weekend, but sometimes we didn't have enough vaccines. We could only open one day. So we would start with how much vaccine do we have? And how much, what are our cycle times? What are our lead times? We had to look at the footprint of the building. So kind of to Nate's point of the observation chairs, how many could we actually put in there safely, social distancing? Understanding our no-show rate was so helpful. And then just root cause on things that were bottleneck was so key. So the one time I talked about I have to admit, we had a really crazy day one weekend where Saturday we had a 3-hour wait time. And then the very next day we were back to our 20-minute cycle time, but really getting into root cause of that, what was that? And that actually was a day that we decided we just want to go full board and do over 30,000. I forget what it was, Dana. But we weren't 100% prepared because we just didn't have enough vaccinators. So just in time to fix that, we pulled, myself, who's a nurse, other ones that were there to go in and help vaccinate, because we knew that was our bottleneck. We needed more people. So as we wanted to continue to grow, our goal was 4,000, just kind of a hypothetical goal that we thought the footprint could support. We had to look at all these other things, again, of how many operators are needed to actually do that. So I hope that answers your question. Dana, you probably have more.
And I would just say, would add, just so you can understand the climate, the state Department of Health would allocate vaccine, the amount of vaccine to the King County Department of Health. And then King County, say if they got 20,000 vaccines or 20,000 doses, then they would allocate to all of the healthcare agencies within King County how much vaccine they would get on a week-to-week basis. And we wouldn't know how much vaccine was actually going to be allocated to us until like the Tuesday of the week, for the week coming up. So you couldn't like just build a schedule and fill it, because then you would, in the event that happened a couple of times where we did not get any vaccine, then you would end up having to do the waste and muda of canceling all those patients, which is just a horrible PR thing to do. So really dictated by the allocation of vaccine, which at the beginning, the first few months was very, very tight. I believe that by the end of May, when we were done with our super vaxes, I bet we could have put through 5,000 a day in that 10-hour period of time had we had the vaccine and the demand to receive the vaccine.
Well, thank you for that answer. Pretty remarkable how you ramped up. There's a question about no paper and vaccination cards. Nate, you want to elaborate on how you guys manage vaccination cards?
Sure, that was the one card, that was the piece of paper, because those vaccine cards, people treated them like gold. They would bring them back for their subsequent injections. They would come back if they was a piece of information missing on them. Although they're not official, they're not the Washington State official record of immunization. We would get those vaccine cards. And at one point, we had to really watch our vaccine cards because they became like on the market, on the street, a very desirable commodity. So, you just could imagine that people would want to steal vaccine cards, but there was that happening early on in the pandemic or in the vaccination attempts.
Good, thank you. Anybody else have any other questions they'd like to ask?
What are you currently doing now? What is your current workload?
Okay, so we have moved vaccines to being done in flow in the clinic space. So as patients come through, we actually did a Kaizen event, used our tools to understand how could we identify patients wanting the vaccine as they come in for their regularly scheduled appointment, provide that vaccine, make sure that they have the observation time. So it's being done in flow. And the reason that we're able to do that is no longer is vaccine availability like precious gold. In fact, the Department of Health has totally swung the opposite direction. That if you have somebody in front of you that wants a vaccine, go ahead and crack a new vial, even if you're only going to give them one dose, and throw the rest of the vial away. So it's just the pendulum has swung so dramatically from scarcity to abundance.
Just to add on that though, it breaks it. It's like a sword in our hearts to waste any of that. So at Virginia Mason, we are using our lean methodology tools to kind of figure out how do we batch patients maybe that need to come and get their doses, or even have a runner kind of take it to different places so that we're trying really hard not to waste, even though we can.
But I would say one thing that's interesting is in the hospital setting, you know, at one point there was a movement to think that every patient who came into the hospital should get a vaccine while they're in the hospital. And we've really kind of veered away from that, because for some, there really are side effects. I know myself personally, Jessica as well, had pretty significant side effects when we got vaccinated. So the last thing you want to do to a patient who's in the hospital, acutely ill, is to give them a vaccine that could cloud the differential diagnoses that goes on. Or one thought was, we'll give it to them as they're going home. But for some who react, they'll just bounce right back and be an unplanned, unpaid readmission because they'll come back into the ER the next day because they feel so lousy after getting a vaccine. So only for those patients that are kind of off the grid, whose providers like infectious disease follow them, are we giving in-hospital vaccinations.
Interesting piece of the puzzle. Thanks for sharing that. Any other questions? All right, well, Jessica, Nate, and Dana, thank you very much for sharing your story and doing a virtual tour with AME. You know, we've done tours at Virginia Mason for the last 5 or 6 years, as Barb knows. We skipped 1 year because of this crazy COVID scenario, but I appreciate you catching us up with this story. And Laura, thank you very much for helping us get this organized. I appreciate your help and sure that we're able to keep AME running in this virtual model. Art and Chris, there's a discount for a healthcare summit if you're interested. If you enter all caps today 50, we'll give you a $50 discount on a healthcare summit that AME is running next week, where we've got other organizations like the Cleveland Clinic and I think University Hospital from Ohio presenting, as well as some really valuable speakers who are going to share their stories. So I want to thank you for your time and appreciate you participating, and